Dr. Ann, can you just talk a little bit about what you're excited about this year? Like you're talking about possibly my hair after you do kind of this gene testing. We know that, what is it, Gary Brecka is talking about gene testing.
Yeah.
So it's not just hair, it's you said you're actually gonna put capsules together based on just what my body needs.
Yeah, so that's all part of...
To answer that question, can you go back to the previous slide so we can see your phone?
Yeah. So there's lots of things that I'm introducing again this year that I'm excited with. So the longevity program encompasses all of that. But specifically, to me, genetics and epigenetics is the future of the way healthcare should be delivered. So healthcare, I feel, and I've always practiced this way, should be personalized. So just like that person that goes to the gym that says, hey, that guy's taking 300 milligrams or 3 times more testosterone than me, should I be taking the same? No, because you're not the same person. And so it's all about personalized care. And so now, in addition to being able to do blood work, we're able to check DNA and epigenetics of patients to see like hair loss. Again, big thing among men and women. And what is driving that hair loss? Because most of the time, what do? You go to see someone, you go to see a doctor, and they ask you a few questions and they're like, okay, well, let's just try this. Okay, let's try the topical, let's try some pills. And it's kind of like a shot in the dark. But now we can really see, we could test people to see, well, like, what's driving your hair loss? Is it male pattern hair loss, which is DHT driven? If it is, then a lot of these medications may work. Same thing for acne, right? For people who have acne, whether it's yourself or kids, like what's driving that? And how do we be able to then provide you with a personalized regimen that will work on you based on what your epigenetics show? Going to your customized supplements. The idea is everybody's body is different. Our deficiencies are different because our diets are different and our lifestyles are different. And so taking a multivitamin, taking magnesium, taking, all of these like omega, those are sort of generic stuff. We're in a place where we can now custom make a vitamin based on your nutritional deficiency that we can get on through blood work to be able to provide you with a multivitamin or a supplement that's based on you and your risks, right? So again, in the longevity program, if we come out and you say your epigenetics show that you're at a higher risk of heart disease and a higher risk of diabetes, and your other blood work shows that you're deficient in things like zinc and some magnesium and some calcium, right? Or manganese, then we give you a supplement to replace those things that you're deficient in, but also put it in the same capsule, these other things that are gonna be helping you for your risk of heart disease, like omega-3 and some taurine and for diabetes, some berberine. You know what I mean? Like we could put them all, so you're not having to buy 10 bottles and you just like, I have patients who complain that they're like, okay, well, I've got like 20 pills that I gotta take. And I've looked at the 20 pills actually, and even for me, it's hard. Like it's very daunting actually to look at 20 pills and think you got to put that all in your mouth at a certain time. It's hard, right? And so the idea is, again, we're moving to personalized medicine. But just to be clear, we do not provide primary care. Okay, so this is not meant to be competing against medically or publicly insured services. Okay, this is not for you to say, oh, I don't have a GP, or you're gonna be my GP. No, because that's not allowed. Okay, this is strictly private, uninsured services. Yes?
So, there's a lot of guys in here that obviously take a lot of pride in their hair.
Thank you very much.
And so, I've thought about taking tea before, but I've also heard that it may have an effect on hair loss. It may affect, like, it could increase.
It's certainly possible. I wouldn't say it's common, and it's certainly not a guarantee.
Yeah.
unless you're taking the doses that the gym guys are doing.
No, because I thought about doing it just for sharpness and stuff like that. I don't need to be jacked. Just for more mental clarity, but if I'm risky losing my hair, then
So-
it's definitely.
Yeah, that's a money thing.
Yeah, so I would say that I'm just trying to think, I probably have 0 patients that I haven't been able to control their hair loss on testosterone. So at the worst, they stay stable.
There's hope for me.
You.
What? You would have lost your hair by now there, Dan.
Well, you know that. That would be the whole way. Gets extensions.
Can we go back to HGH and just how it's, I mean, maybe for me, it's just a stigma attached to it. Like we were talking about this the other day, where it's like, that's how Barry Bonds and Mark McGuire, won the home run records and all that stuff.
Sure.
And like how it's used, I guess, in a safe environment like this? Or is it just always been safe? We've been left with that stigma of how it is spoken about in the news.
Yeah, so just to be clear, Barry Bonds and Mark McGuire, if they were on GH, it wasn't the scrutiny wasn't that it wasn't safe, but it was more that it was a performance enhancer, and it is a performance enhancer, especially at higher doses. I will say this about GH. Strictly from a longevity, because I have patients who say like, hey, I just want to be put on medications or treatment that's going to help me live the best and the longest. The data for growth hormone actually isn't there. Okay, so you'll have differing data. You'll have some data that says, oh, growth hormone prolongs life, and you'll have some data that says growth hormone shortens life. Okay, because in the end, it just makes things grow. I use it cautiously in patients, not so much from a longevity, but more from a lifestyle standpoint. So for instance, my patients who exercise really quite vigorously and hard, it reduces the aches and pains afterwards. All right. I never push people, or rarely push people beyond the normal limits of what the blood work is. Okay. And so the risks of growth hormone, if you look at it, are usually associated with cancer. And the idea is it can increase your risk of cancer, but only so much as if there's cancer inside, it acts as an accelerant. Okay? So if there's no cancer in your body, it's not going to cause cancer de novo. It's not going to cause a new cancer. But if there is a cancer sort of sitting in there, it's potential that it can increase it. Okay? And make it grow faster. Because it's an indiscriminate growth factor. And so that's how I use growth hormone. So is it for everyone? No. Do I have people on it? Yes. If you want it, do I think it will help you live longer? No. Will it make you look younger? Yes, probably. Yes.
Is there any merit to that you are taking HGH or other hormones, not under the care of a specialist like yourself, that there can be damage to like your liver, you're not doing the program right?
For sure.
Their quantities are off, which then creates inflammation, which is exactly what you're trying to get rid of for longevity.
Absolutely. You're absolutely right. So we know that testosterone in terms of just cardiovascular risk, okay? The cardiovascular risk curve is it's like a parabola, it's like upside down, okay? Which means that your cardiovascular risk is high if you're low in testosterone, like really low. So when you look at like one of the things that I see or check for when patients are say 33 or 35 men who have heart attacks, I look for low testosterone, okay? The same is true when you reach the other side, which is too high. When you're too high, you accelerate your risk of atherosclerotic disease or heart disease and the chance for a heart attack. So yes, you increase your risk of lots of aging and of lots of conditions by not being properly monitored, right? And I've had patients come to me, it's sad, when they're 28 and they're in testicular failure. Like their testicles have stopped working. Like they don't produce any testosterone anymore, which sucks, obviously, because now they can never have kids, right? And they wanted to have kids because the testicles are shot because they took these things like SARMs or these gray market anabolic steroids, right, from the gym, and their testicles did not respond well, and it's just completely shut down, right? Will they regain it? I don't know. It's been 2-3 years already, and it hasn't come back. I don't know, right? So yes, there are definitely consequences. So I have patients come to me. There are some patients who clearly used to be on the gray market of testosterone, or were prescribed by someone who really didn't care about monitoring people. And they're like, I want to drive my testosterone higher. I feel better. I said, yeah. I mean, most men will feel better if their testosterone was 10 or 15 points higher, right? That's because those men, they feel like they're supermen, right? Literally. But not for your health.
By the way, once you're on it, are you on it, or is it like a cycle you go through for a period of time to get into a...
No, so there's no cycling. So the cycling is for people who are using it in the gym. And the reason for it is, again, I would suspect, to try to reduce the risk of complete testicular shutdown. So your body doesn't totally shut down because you've been using, because they're using, like, just to give you an idea, most men would be, for instance, testosterone would be, say, between 75 and 125 milligrams. And these people are using 400 twice a week. So they're using like 800 milligrams a week. Right? So that's why they cycle.
What about side effects like aggression, anger, maybe some strain on your tendons, those type of things? If you're under proper care, are that eliminated or
Correct.
or like gone, or those are still there?
No, so you just think of it this way, right? The testosterone that we use is bioidentical. So your body uses it the same way as your own testosterone. So if you were younger and your testosterone ran higher, say 30, and you already had all those problems, right? Like you already had anger issues, you already had rage, and now you're more calm, chances are you're gonna go back there because that's how your body responds to testosterone of 30. If you're not like that, it's not gonna give you that rage that we tend to read about unless you are being pushed too high. Okay, does that make sense? Yeah. And so that's why it's important to be monitoring patients regularly.
I got 2 questions for you.
Yes.
First one is, so I would imagine patient comes on board, sends them to do the blood work, so you know exactly what to give them. At the beginning, probably seen that person a little bit kind of
More frequently? Yeah.
Until then, now you're almost like on a maintenance sort of thing where it's every so often. Is that kind of how it works?
Yeah.
Okay.
Yeah. And so, yes, but to clarify, I always see patients at least twice a year. And the reason for it is actually very simple. And when I explain it, everyone understands. Your bodies are not static, right? And what the hormone optimization does is it looks like, let's say your range, let's say we're trying to get you to 10. I'm just picking a random number, right? 10. Your body makes 5.
Right.
I'm gonna give you 5, right?
Exactly, yeah.
But guess what? The 5 that I give you doesn't change unless you change it. But the 5 that your body makes does change,
Yes.
right? Based on what we just talked about. It may actually make 6 or 7, or if you're really stressed and you haven't been taking care of yourself, now it could be making 3 or 4, right? And so if I see you in a year, it's gonna be way lower, or I don't see you in follow-up, then you're just stuck and you're never feeling optimal. So I've done it where I've actually had patients recover their testosterone production, so I've had to reduce their dose. And I've had it where many times I've had to increase the dose. And so, yes, the first onboarding, every 2-3 months until you're stable, and then afterwards, 6 months.
Perfect. And the other question I've got is, I think, I remember correctly, the normal range of testosterone is, I think, like from 3 to
9 to 29.
yeah. So, which is like this massive number. What is your thought on what normal? I mean, obviously it's going to be different for every person, and because it's such a massive gap, that's why you've got young people with like really low and older people with really low. What should that number really look like?
So again, it's personalized, right? So which means that it's not only a number that we're aiming for, but it's where the person is. That's why I think it's still important to speak to people, right? Because people maybe, for instance, I have an older gentleman who actually doesn't want his testosterone higher than say 25. It was his spouse actually that told me that, because it was too much for their life.
Yes.
Do you know what I mean? And I think that's, you know, it's it's an important consideration, right? To be able to consider these things, right? And so some people may not want all of that drive and motivation back, because when they were 20, they were like, I gotta go and I gotta make 10 companies. And now they've made the 10 companies and they're like 60 and they're like, actually, you know, I don't want that. Actually, I just want to feel a little bit better, right? In which case you aim differently.
Yes.
Yes, of course.
Speak between peptides and hormones, and are there peptides that you could be taking that could maybe change your hormones versus like just like taking testosterone?
Yeah. Peptides in general are not legal in Canada. There's one that is, but the idea of peptides is to give you some like a medication to stimulate your body to make that hormone. That's the idea. And I like the idea of it, actually. If you could use your body's own machinery, it's under better control because it is within the feedback loop. So if it's too high, it'll suppress stuff. And so I like the premise of it. It's just that we don't have it readily available here in Canada from a legal standpoint, which is funny because I had patients come to me and say, well, that's interesting because I just bought it on Facebook. And I'm like, yes, I know. That's really the only answer I can give you. I know. But you can buy all sorts of stuff on Facebook. I don't really know how. Any other questions?
Well, this is good. I told everybody that we'd be an hour, so time out of work, all that sort of stuff. Listening to you, I wish we had double the amount of people. It's very interesting.
Good.
You are doing your own seminars at night here. You did one last week.
Yeah,
And is there another one?
we will. Crystal is organizing it.
So if you want to learn more, or is it a different topic or the same?
We'll go, yeah.
Yeah, we're gonna have a series of different topics.
Okay.
Because each, like I said, you saw at the beginning, each division and department has a lot of education behind it. So we are doing a series of different, topics. And then as well, we're also filming each of these webinars, or each of these sessions as webinars, so people that can't join. Today we'll send that to you and you can share. But of course, anyone that, these are free and they're for educational purposes, so that people can start to learn how to take care of themselves better. So everyone's welcome, and we'll share the invites amongst you then.
And when you do it at night, is it longer?
No, it's about the same time.
Oh, I
Yeah.
see. I thought you went into, into.
Yeah, I didn't talk about my longevity that night one. It's just hormones for men and women.
See that, yeah, hour and a half formats, like now, like, you know, the talk and the questions, they're now, but we could put an hour and a half.
I mean, I could talk forever, but I don't think anyone's attention could last that long. So we'd like to keep it short.
Yeah, and the idea is that you get enough information today that you can book a 15-minute consultation one-on-one with JP, and he can advise you on what's best and where to start. Because again, the other part, what Ageless Living really offers is an opportunity to call it choose your own adventure, but like, where do you start and then where do you go from there?
Good. Well, thank you very much. This is
You're welcome.